But thank you so much for taking the time to speak with
Sure.
me. Obviously, we're learning new things about Governor Abbott's just new
Yeah.
order, rescinding a lot of the initial orders from the beginning of the pandemic. He's rescinded a lot and kind of lifted a lot of orders. So, what is your initial takeaway from his announcement?
Yeah. So based that, I don't really know the details except as much as you know. I saw what was put out in the press. Let me just summarize it because I tend to talk a lot. I think it's too much, too quick. I'm the first one to say our numbers are so optimistically getting better, and I'm all for opening up and being more liberal in what we can do. But I think that there's steps that you take, not even necessarily baby steps. They can be regular steps. But I believe that the ending of the mask mandate should be the last thing, not the first thing. Other steps I think should come beforehand would be stuff like parks, recreation, camping outside, perhaps opening up restaurants to 100% outside and maybe 50% inside, still having masks. And then as you move and the numbers get better, absolutely, then that's eventually where we want to go. But I think that's the end point, not the beginning point. Let's remember this. We have approximately 50,000 people that have tested positive. So let's say multiply it times 3, that's 150,000 people that have tested positive. And so let's look at those people that got vaccinated. That's another 120,000 people so far. So we have roughly about 300,000 people out of 800,000 people that have been vaccinated. What about the other 500,000 people? So we're getting truckloads full of vaccines coming. We have Johnson & Johnson with their third vaccine coming in. Our numbers are going down. Absolutely a great time. Keep the mask on. A little too early, a little too quick.
What do we risk by going a little too quickly? I mean, what are the risks of moving too fast? Do we risk having everything re-implemented? Do we risk more deaths? I mean, what do you predict just moving this quickly?
Prediction is hard to say. I can only go back toward the past. Homo sapiens, we've been around for 200,000 years. It's hard for us to change our imprinting in 1 year. Why are we successful? No Neanderthal, no Homo habilis, no Homo erectus, no Homo forensis, no Homo ergastus. Why Homo sapiens only? Because we're very social creatures. That's what got us through. So I can't expect people to change what they've been imprinted for hundreds of generations in 1 year. And we've seen that. Remember May 1st, when we opened up the community, we went from 13 people dying in 5 weeks. A month later, we had 40 to 50 people die every day. The only thing that was different was we opened up the community, no masks. That's the only thing. Then what happened in July and August when we closed back the community? The numbers went backwards. So I am the #1 supporter and optimistic person of human behavior as your health authority for Hidalgo County. I love my community. I also need to look at what we've seen, our past history. And our past history is we're not paying attention. So I believe that when you take that stigma of the mask away, people are not going to wear the mask, numbers are going to increase. Now, how much? How can I predict it? I can't. But I can tell you that 9,000 illegal immigrants coming in every week to our valley. The average age is 29 years of our people in our own community. We have some different criteria, some different impacts than people in Odessa, than people in Dallas. Our population density is long. We have 1 million people in a 35-mile area. So we tend to transmit it slower because our density is so low. We have all sorts of strains and people coming in that are not part of our community through the illegal immigration system. And we have the average age of 29 years old, which is about your age. And when you're 29, you can eat nails and nothing happens to you. And you don't pay attention. And so we're not the same community as Hyde Park, Dallas. And that's why I think that every community should have the flexibility to implement the local recommendations.
And to your point, how will the Hidalgo County Health Department, Health Authority, and other county judges, how will you guys navigate this new order? Have you guys had that conversation yet? Is this something that you guys maybe had a little foresight of and kind of had these conversations prior to this announcement, or how will you guys navigate this now?
So did we have an announcement beforehand? No. Are we aware that this governor, for whom I have the greatest respect for, but this governor absolutely acts independently, autonomously, and we've appealed to his flexibility many times before and have not been very successful. If you ask people a month ago and before, what is the number one recommendation? What can the health department do? Everyone would say the exact same thing, which is what? Close it down, close it down. Of course, we didn't have that authority. So do we have foresight? No. Is it surprising? It really is. I know that we can't live in a vacuum. So there's definitely some political implications to this. And that's a reality. So we have to live with it. So we knew that we were moving into a more liberal scenario. And we, in fact, we support that we need to move toward a more liberal scenario, but not to this extent. We didn't think that it would be, all season out, no mask, do what you want.
Does the county have the authority to act autonomously and to keep some orders, still going? Or is it now that Governor Abbott has given this order that counties have to follow suit?
That's a great question. First, let me just say, let's not forget, the governor said, in my understanding, that if hospitalizations once again are above 15%, 15, then the local authorities can have some autonomy in deciding what else they can implement. Although I don't see exactly how much, but he said some. Let's also remember that traditionally it was always the local authorities that had the flexibility to maneuver in that community. If a hurricane or if an earthquake or if a storm came in, the local authorities would say, no, we need it more in FAR than we do in McAllen. No, we need it more in Weslaco because that's where the thick of the problem is. But May 1st, the governor took that authority away. Well, it had traditionally been the local authority went to a state authority. And he stated in May, and it was challenged, and he won, that he, under an emergency measures, had full authority to tell us basically what he thought was the best plan. And so the answer to your question is, as of right now, we have minimal authority. Minimal authority. If I understand this correctly, if 15% of hospitalizations are COVID or more, he's allowing us to have more authority. How much more? I don't have the detail.
All right, perfect. And anything else that I didn't ask you, just in terms of, just this announcement, what you want people to know, whether you still want them to be vigilant? I mean, a lot of people are gearing up for spring break. And with this order, it does risk people from, different states, people from different counties, all flocking to, our area, which could increase COVID cases. So what do you want people to know just about maintaining some sort of, vigilance and being safe when it comes to COVID-19?
So I would say, number one, we all understand that the numbers are dramatically improved and look forward to moving toward a more liberal scenario. Number two, let us remember that the governor's orders are one size fits all, and that I should remind them that the Rio Grande Valley is completely different than Odessa and Dallas and Houston. And so I would remind them that we had at one point the highest mortality rate, that our hospitals were packed, that it would take a month to get buried. And so we're different. And we're different specifically now because of all the migrants that are coming in, 9,000 a week, plus all the potential tourists that are coming in. And so I think that, remember, common sense from a local perspective, the last thing I would do would be to stop wearing a mask at this point. When do I perceive that things will be to the point where we may consider a more limited mask? If the numbers continue the way they are and vaccinations continue as they are, I would estimate by the middle of summer that we would be ready to take a more liberal approach. We're certainly not the beginning of March. So please, I would adhere to the same recommendations. For those of you that are in the sports world like yourself, you're in the bottom of the ninth, you're in the World Series, you're winning 2-1. Do not put the bench in. Wait till there are 2 outs and 2 strikes. Then you can be more liberal. A little bit more. Just a little bit more.
Perfect. And so if I'm understanding you correctly, Governor Abbott says he's lifting mask mandates. He's letting businesses operate at, 100% capacity by this time. So meaning you guys, if we get past the 15% threshold, you guys might be given more authority to say, hey, we need to pull back a little bit. But as it stands right now, Governor Abbott has given this order, and when it takes effect, you know, you guys can advise, but not giving any orders that kind of reverse and go opposite of what he's saying.
You are 100% understanding it correctly, with the caveat that only elected officials are able to make policy decisions. Even locally, only our county judge, which is really a misnomer. He's the county administrator.
Right.
Only he can do it because he's the only one, and the commissioners, because they're elected. We can only advise. And
Right.
so our advice is slow down.
Perfect. Got it. Thank you so much. I really, really appreciate your time.